Hi, everybody. I'm Dr. Hillary Fredrickson. How's it going? I'm here with Cultivate Foundations, and Dr. Kara's on vacation, which is amazing. It is April, and it's spring break week here in California and also in Connecticut for the kids. So she's spending quality time with her daughter, which is so important. And it feels very different. Today's the day of the big eclipse. And for all things eclipse, you want to go check out my brother, Gemini Brett. He's all things up above the world, the stars, the sky. I'm all things down on the earth, like the groundedness stuff. But we're talking about skin. This is the month of skin. There's a lot going on as we age. I'm almost 50, and I've noticed that there's been a lot of changes to my skin, obviously, naturally. But I think in general, I've been really interested and excited to see how we can get skin better over time as we age. Like, find maybe it's not going to be the same quality as the skin of our, children or when we were younger, when we didn't really have to think about it. But there's so much that we can do to help our skin. This morning I use estrogen cream on my skin. I'm in perimenopause, not officially menopause yet, but I've been using topical estrogen on my skin for about a year to help with fine lines and wrinkles and really to help with the quality of the skin. Today we're talking a lot about rosacea. I have a lot of patients who have showed up with some sort of skin change here, whether it's melasma, like a browning of, or rosacea, which is a reddening, a readiness. I have makeup on, so you can't see mine, but this morning I woke up and I have some rosacea. So I just want to talk to you about how are some of the ways as naturopathic doctors that we treat rosacea or skin-related changes. And really, I think there's 3 ways. And April, I'll be giving you the play-by-play because I'll be doing all of them on myself, trying to heal my rosacea. Rosacea can come from a couple different things, but age-related change. So a lot of times it will flare in perimenopause, menopause. Those of us that are from Northern England or Ireland or Scotland and those countries, like, we're definitely more at risk than more olive-skinned people. But it is a reflection of what's going on in the inside. As you've heard from us many, many times, skin is an inside job. So there's some testing I highly recommend if you have rosacea or a skin issue that keeps flaring. And with any skin issue, eczema, rosacea, psoriasis, skin flares, meaning that you'll have times where it feels like you're in remission and things are better, and then you'll have times where it flares and you are worse. So I'm wearing a blood sugar monitor right now because this is definitely very reactive and subject to sugar. And so I'm trying to see if I can keep my blood sugar down. It's not even just if I eat sugar, it's if my blood sugar is high, and that can happen from lack of sleep, stress, not eating enough protein, not eating enough carbohydrates. So it's not just if I'm eating sugar, I don't really do that. But even if I don't eat sugar, my blood sugar can be high. So I'm really working on my blood sugar, getting ready to move into the spring detox. And then thinking a lot about food sensitivity. So food sensitivities are a really common part of skin issues. And you've probably heard us talk about that a lot. But and as we age, we can have more food sensitivity. Sometimes it's like, you'll remember when you were a kid, you used to react to dairy or something. And then in your late 40s or 50s, you're reactive once again. We become more sensitive to things. It's like red wine. People use, women in their 30s don't really complain much about drinking red wine, but women in their 40s will say, or late 40s will say they get hot flashes and they can't tolerate it anymore. It's really common just with age-related changes. So we want to think about what we do topically. And in our skin program that starts on the 22nd, that's a 10-day detox program all about skin. We're going to talk all about topicals. So that's coming. I just wanted to let you know that you can use estrogen topically. And if you haven't done that, then it's worth speaking to your prescriber or working with a naturopathic doctor to get some topical estrogen. And then looking at food sensitivities, gut health. So a lot of times I do GI testing on my patients in their late 40s or 50s as a screening test just to see what's going on in your gut microbiome. So I'm about to test mine this week. It's been a while for me that I've done it, but I do it hundreds and hundreds of times with patients. So H. pylori is a very common bacteria that lives in the stomach. H. pylori can cause rosacea. Another thing that can cause rosacea is what we call SIBO, which is small intestinal bacterial overgrowth. It's not naming a specific bacteria, but it's saying that there's bacteria living in your gut where it shouldn't. And that can happen after antibiotics. That can happen with stress. That can happen if you live in a moldy house. That can happen if you got bit by a tick and you're exposed to chronic viruses. That can happen after COVID. That can happen. So there's a lot of different times. It's like immune suppression. So it's sort of like when people get the shingles, they can be really tired or stressed and have a lot going on. And that will show up in the skin. Shingles also a skin issue. There's a skin component, skin manifestation. So GI testing, food sensitivity testing, these both give a ton of insights into what's going on in the skin. We do them on little kids for eczema or teenagers, and for older women as we age, we do it for skin. And even if you're not having rashes, changes to your skin, these are good tests to do just to get baselines and to figure out what's going on with my gut microbiome. So it's a really good thing to do before doing a detox program. Like, what are my food sensitivities right now? Does my stool test show that I'm having gut microbiome issues? Is there a leaky gut? What's going on with that? So those are really important, interesting things to look at and think about if you're trying to heal any skin issue. Caffeine, sugar are always the big, and alcohol are always the big no-nos. You'll always see that alcohol or alcoholics, you can often see that they'll have changes in their skin. They get flushing. They get a lot of vascular dilation. Sometimes even the nose changes. My doctor said to me, you want to be really careful of your rosacea because your actual nose can grow. I was like, I mean, it's so brutal. So for a lot of topical things, that there are topical medications, topical antibiotics, lasers. We're talking about right now what's going on the inside out. So if there's an H. pylori infection or a gut microbiome issue, I treat those things. Sometimes I do use antibiotics if a patient's very symptomatic gut-wise, but mostly we can treat this with herbs. And the herbal medications are multi-systemic. Kara had mentioned on a previous show, a lot of the herbs that we use to treat skin are liver herbs. And so as we're treating liver, increasing detoxification, calming down the system, the skin calms down. So you'll have heard us say that people post detox will be a lot brighter. Their skin will be more radiant. That's because they're having more water, eating foods with more water content, reducing some of these heavy, sticky foods that make it hard to digest, and it shows up in the skin. The skin is reflecting what's happening in the internal environment. So as we go into turn the corner here, we start our detox in 2 weeks, and it's really important. If you are interested in doing any testing, doing it now, food sensitivity testing, gut microbiome testing before the detox, or during, or right after. Of course, you can do any of the testing afterwards as well and just see how things feel. Many people will report feeling significantly better on the detox, gut-wise, skin-wise, energy. And that's a really good time to do some testing afterwards, after you've been eating cleanly and seeing what's happening in the gut microbiome. So just food for thoughts. This is our skin month, April. And we want to focus on, one, all the nutrients that are important in maintaining skin strength. We want to prevent getting skin cancers. basal cell cancers, squamous cell cancers, obviously melanomas. Melanomas can be really dangerous. And hopefully, if you're at risk of melanoma, you've been getting skin checks with your dermatologist annually. But we want to think about what will make our skin feel luminous, do its job, have not a ton of symptoms as we age into our 70s or 80s. It matters. Its skin is really a barrier. It's our barrier to the outside world. It's a detox organ. So yes, we're talking about beauty and luminosity and feeling beautiful, but it's a very important organ to protect function wise. And we don't want to end up having a lot of things cut off or having to deal with a lot of procedures as we age, because our job is to keep you out of the doctor's office as you age and out in the world having fun. Anyway, today is April 8th. Happy Eclipse Day. I hope everybody's somewhere doing something cool or taking a moment just to kind of reflect on the eclipse season, maybe putting down and burning and ridding and shedding of darkness or patterns that you want to release, inviting new things, new energy into your field. And let's just have a really great week. All the links are dropped here about our detox. It's like a $97 10-day program. So there's no reason not to do it. You're going to get flooded with info. And then there's links for food sensitivity testing as well. So now is the time, if you think, okay, I've got something going on with my skin, I want to do the detox, I want to get info before the detox starts, get your food sensitivity test. You'll get results kind of right in the beginning of the detox. So that's pretty awesome. All that's included when you get the test. So that's kind of what we're thinking about with Skin Month. It's an inside job. You've heard us say it, but now it's time to kind of test and look and see what's going on. And I'll be giving you my play-by-play on my healing journey. But my goal is that in a month, my lesions or my rosacea is significantly better. I was under some stress in January and February, just some life stresses. And so my skin got a lot worse. And it's interesting to just see how it follows. It's not always immediate. It can be in the following month. So I've had some what I call flares, and that's going to get better. So obviously it's a lot of personal details, but you're learning just through my journey, and everybody can kind of relate. Many women, even if you're not having this now, it may come up later. And so you'll have tools about it. And if it's not this, but it's dry skin, eczema, psoriasis, same sort of thing. Sometimes dandruff, it's all sort of the same thing. It's just showing up in a different place. So inside job. Talk soon, everybody.